I'd like to welcome you to this episode of today's podcast, which is part of the Obstetrics and Gynecology Revision Series. So, today we'll be talking about the management of puerperal sepsis, and we'll start by giving you a VINIAC. A 25 years old para 2 plus 0 presented 5 days after home delivery with history of fever and generalized body weakness. She was found to have temperature of 38.5 degrees Celsius, abdominal tenderness, and offensive lochia. Now, as you all know, we follow a particular pattern in the management, which start with the introduction, then history, physical examination, then investigation and diagnosis, then treatment. Now let's go straight into the introduction. Genital tract infection following delivery is referred to as puerperal sepsis and is synonymous with older descriptions, as old names of puerperal fever, milk fever, and childbirth fever. Now, the history. Now, as you all know, history contain both risk factors, names, and so many things. But we'll just hear, since we are trying to focus on how we'll be able to know which disease we are dealing with and manage it. So we'll just talk about the important pathological things that you'll be expected to ask, and you'll be expected to see, and all those kind of things. Now, from our VINIAC, patient is 5 days postpartum and delivery is at home, which is a risk factor because in the process of the home delivery they can introduce infection, because normally home delivery is not septic, it's not antiseptic, so they can introduce infection. So the things they would use, like in cutting the cord, might not be clean enough. It might contain some germs and they can injure the patient in the process, since those doing the home delivery are not really experts in the field of that. They are not obstetricians or midwives. You need to check out for these risk factors as classified. Now, underlying conditions: is the patient obese, diabetic, or having HIV? Now, as you all know, obesity predisposes somebody to so many disease. They easily get infections. Now, diabetes, same thing. HIV is an immunocompromised state, so the patient can easily get puerperal sepsis. In the antenatal stage, chorioamnionitis can be a risk factor. Uh, Preterm rupture of membrane can be a risk factor. Cervical sacrilege, which is kind of a surgery which is done to be able to block the passage of the cervix, and incompetent cervix to make it competent before the time of delivery. It can be a risk factor also. Intrapartum conditions. Now, prolonged labor. Now, a person with prolonged labor is predisposed to all those conditions. To multiple vaginal examination. It's not advised to be doing a vaginal examination up and down. So, instrumental delivery. Uh, when we say instrumental delivery, we are talking about the forceps and vacuum. So, using that, it can introduce infection into the human. And cesarean section. Now, cesarean section is very important because most of the people with puerperal sepsis are due to cesarean section, which the the antiseptic procedure was not properly done. Then manual removal of placenta, retained product of conception can be a risk factor for puerperal sepsis. Now, major symptoms. Now, that's what the patient presents with. As you can see from our VINIAC, there's fever, generalized body weakness, malaise, headache, rigors, abdominal discomfort, vomiting, and diarrhea. Offensive lochia. Lochia is just the fluid which comes out of the vagina, which contain mucus, blood. It comes out through the vagina 4 weeks, after delivery, to approximately 3 to 4 weeks. So if it's offensive, it's trying to tell you that there's possible infection. And next is secondary postpartum hemorrhage. So We'll talk about postpartum hemorrhage in another of our series. Now, physical examination, which is the signs, that's what you see as a doctor. Uh, Pyrexia. Pyrexia, when you use your thermometer under general physical examination, the patient will have temperature above 34 degrees Celsius, and they said at least 38 degrees Celsius. So here our veniac, the patient have 38.5 degrees Celsius, which is trying to tell us that he's most likely having puerperal sepsis. And tachycardia, when we say tachycardia, is increased heart rate. And uterus, now if you do um the examination, that's you the uterus will be bulgy, tender and larger. Normally, the uterus should be shrinking after delivery, but in a situation which is not shrinking, is boogie, as baggy, big, like tender, painful, and large. This problem. Infected wounds, like after cesarean delivery, if there's infection of the wound, so it's another problem. Or perineal wound. Peritonism. When you say peritonism, uh, this is peritoneal sign, that's pain around the abdomen, which is not related to peritonitis. When there is no peritonitis, paralytic ileus has physiological, it's caused due to like the bowel. The bowel is not, the motility of the bowel is kind of lost due to physiological problem. Yeah. So here, next, let's go straight into the um diagnosis and investigation. Now, you can use your you can use your history and physical examination to diagnose puerperal sepsis, but we still need to do some other um, investigations. As we say, sepsis, sepsis can cause end organ damage, especially when the patient have septic shock. So the investigations you are expected to do: full blood count. Full blood count, you might see anemia, leukocytosis, infection. That's because of the infection. Thrombocytopenia, due to infection also. Now, urea and electrolytes, you are trying to check the function of the kidney. So, fluid and electrolyte imbalance can be there. Now, culture of blood or swabs from high vaginal or infected wound. Now, you want to grow the bacteria to know the type of bacteria which is present, so you can be able to treat effectively. And you want to be able to like establish that there is bacteria also. Now, pelvic ultrasound, you can be able to see retained products or pelvic abscess. As you all know, abscess is one of the complication of puerperal sepsis. In our clinical rotation, I've seen a case of puerperal sepsis. It's very bad. It's not something you like a woman to experience. Now, clotting screening, hemorrhage or shock, you can be able to see DIC, disseminated intravascular coagulation or coagulopathy. Now, DIC normally set in when there's toxemia in the blood. So, in this case, can make somebody get toxemia in the blood. Now, blood lactates, that's blood. You can be able to see acidosis, arterial blood gas, acidosis, and hypoxia. That is what we are trying to check in that case. The next thing, as you all know, is the treatment, which some book they just use management as that. But here in our own setting, when they say management, is more than just about the treatment. So here we can classify it into two: mild to moderate infections and severe infection. Treating infection is, we use antibiotic for treating infection normally. So for the mild, we quickly, that what we start with is broad spectrum antibiotic, e.g. Coamoxiclav or cephalosporins, such as cephalexin plus metronidazole, because we want to quickly destroy the organisms and make the woman to be able to be normal as quick as possible. So, and for severe infection is actually life threatening, and in severe infection, that's when it has really overwhelmed the immune system, and there's a lot of anti-inflammatory uh, this thing anti-inflammatory chemical mediators have been produced, and they, you know, when there's inflammatory response, there will be it causes dilatations of the blood vessels, and because of this dilatation there will be little pushing of blood to end organs, and this can lead to septic shock. So now, for you to be able to like know the clinical features of sepsis and severe sepsis itself, I would kind of say them out now. Sepsis, for sepsis, new onset of confusion or altered mental state. That's for sepsis. And temperature is greater than 38.3 degrees Celsius, or less than 36 degrees Celsius, like in our case is 38.5 degrees Celsius. So we're dealing with sepsis. Heart rate is uh, greater than 90 beats per minute. Tachycardia. Now, respiratory rate is greater than 20 beats per minute, counted over 60 seconds. This is tachypnea too. Blood glucose is greater than 7.7 millimole per liter in the absence of known diabetes. Then white cell count is greater than 12 or less than 4 times 10 raised to the power of 9 per liter. That's for sepsis. These are the things you will see for sepsis. So for severe sepsis, that's like kind of modern sepsis. Systolic blood pressure is less than 90 millimeters of mercury. That's for the systolic blood pressure. Yeah, you are talking about hypotension here, and or greater than 40 millimeter of mercury fall from baseline. Now, oxygen saturation is less than 91%. That's hypoxemia, so low oxygen in the blood. Heart rate is greater than 130 beats per minute, tachycardia, and respiratory rate is greater than 25 breaths per minute, which is also tachypnea but higher than for normal sepsis. Response only to voice or pain / unresponsive. So in the case of GCS scoring, as the Glasgow Coma scale, which we use to assess the conscious level of a patient. Lactate is greater than 2.0 millimole per liter were available, so there's possible acidosis. So then what you do, you give high dose high dose and broad spectrum antibiotic. Just as we said above, broad spectrum antibiotics example is coamoxiclav or cephalosporin such as cefalexin, and resuscitation should be done with IV fluids on a high dependency unit. Septic shock can set in. Close liaison with microbiologist and internal medicine specialist is vital and kind of crucial. So, and another thing you have to take note of is necrotizing fasciitis, which is a rare but frequently fatal infection of skin. From the word necrotizing fasciitis, and mozo, it can originate in perineal tears, episiotomies, and cesarean section. Wound perineal infections can extend rapidly to involve the buttocks, thighs, and lower abdominal wall. Now, a variety of bacteria can be involved, but anaerobes predominate, and Clostridium perfringens is usually identified in this necrotizing fasciitis. So it's something you need to take note of. So that is that for puerperal sepsis. Thank you all for listening. I'd like you to subscribe, like, share to your friends, and comment. Thank you very much.